Oftentimes AI is seen as being, kind of interchangeable, almost the way that we've gotten where it's like, okay, your iPhone and your Android phone, they are different platforms, but both of them are perfectly great solutions for mobile phone, and they tend to have great interoperability. And AI is not there for a variety of reasons. There are very different key distinguishers. One way to break that down, besides are things like, what is the model that they're using, or is it more than one model? Even things like large language models, but even how much training those models have gotten is not something that most healthcare leaders may be able to discern when they're just talking to different competing vendors. It all sounds very similar, right? And then the other thing is the difference, like, what are your data sources? So radiology AI is heavily image-based, but does include some large language model. And the one that I think is really intriguing, the nursing solution that uses pressure sensors, cameras within the room, ambient audio, all of these things. So that's a huge learning curve. I think even for people within IT struggle with that sometimes because it's been evolving so fast. So how do we educate our leaders on that? The other key factor is, how are these partnerships lining up in the background? So understanding, even if the companies haven't declared it first, like, where are those partnerships occurring? Because that's also going to be really more sustainable and prudent for your IT systems, to your IT team, if they can work with vendors that are already integrating their platforms together. So those are two big ones offhand. One of the things that I was looking at in collaboration with more of the data and analytics side is, does that vendor also offer us downstream data benefits? How can we integrate that into our EHR analytic platform? And one of the things that I was working with ADOC on was developing more of like population targeting based upon incidental findings on advanced imaging that would otherwise fall through the cracks. And I think that's very exciting and a very different approach from what you can do for maybe an AI platform that's focused on acute care.